In the recent past, Kenya has witnessed a high increase of food prices, which has strained most of the poor families, especially those in slums. Affordable healthcare too has been beyond their reach. In Kamende and Kiambui slums, we meet one organization that is helping poor families in the area. The Anchor of Hope, as the name suggests, has been working on three main project areas. This is the education sector for the childhood, community-based support for the people living with HIV, and lastly the feeding program, which has been dealing with mainly sourcing for the foodstuffs from donors and distributing it to the needy. Despite the challenging conditions, the organization has been able to keep the brave face in restoring hope for the needy children in the community. We talked to the coordinators of the project,
this organization
who took us through the experiences,
and
they had this to say.
2005, through the vision of the founder, the late David Karaoke, who by then was taking a BA program at St. Paul's Theological College in pastoral counseling. And one of the projects that he had to get involved in was to form a base group to dealing with HIV and AIDS related matters. So he called a few of his friends who had the same kind of vision, and then we saw it twice. The program was only to run for 2 years. So we saw that once he was through with the studies, after the 2 years, those children and the parents we were handling, they are going to be left very, very much frustrated. So we decided we have the organization registered as a faith-based organization, and our main vision is to be able to deal with the OVCs, that is the orphans and the vulnerable children and their parents who are HIV positive. And from that time, at least it has not been easy, but God has been giving us the grace as we moved along. We have a membership of 18 members, and all these members, we are volunteers. At the moment, we don't have a group that is supporting us. So what we're doing is just the members, at least who are making their own contributions to be able to support the group.
Wito ile kamili mahali pale ndipo tukaweza kuwafikia wale wagonjwa, especially watoto, kwa sababu mtoto anakuwa.
Our focus has mainly been on children. Because a child is important to both parents, we have gotten some support from partners and we've used the support to distribute to people living with AIDS. We are serving over 200 people. We usually pick one needy child from each family. We are still looking for ways of fighting this deadly disease. We've also tried to give small loans to some of the parents who are affected. But it's been hard for them to pay back, because the profit they make is used to take care of their condition. So we can't force them to pay the loan, which is a challenge to both the organization, partners and the parents.
We just come here to get some assistance, food, at times they assist us with books. Yeah, that's why we're here, to at least that.
The world is becoming more complex day by day, and other lives of families and communities anywhere are being affected by these rapid changes of environment, poverty, and hunger. Many affected families today need an active spokesperson, especially in championing for their rights and for the poor people, especially the children. As the communities continue to fight against the HIV and other related problems, there is need to develop friendly approaches in working with the different sections of the community, so as not to have stereotypes which may at times cause stigmatization. According to Edith Wamaida, a mother living positively with HIV and a community health worker who has also been taking care of parents and children of the affected families, captures our imagination. She has been struggling to involve other affected persons in their support group and who are living with the same condition, but still, this has proved to be a hard task for her. Even though thinking of this fact and comparing the level of awareness being made by different organizations working in this area, more still is to be done.
Group, we normally get difficulty when handling sick people. In my support group, we have been having lack of equipment like gloves, food, which is normally very important for the sick ones. We would love to have people cared for, like any other person in the community. My child too is affected by this situation. I normally take her for clinic alongside other kids. We work with Lea Toto, an organization where I also serve as a volunteer, taking care of kids under 18 years. I was at some point bedridden, but I'm better now. That's why I want to take this time to also show the same love to my other colleagues who are also worse now. My passion is on kids. I want to support those who are worse, and we have at least tried to sensitize the members on the different ways of transmission. So it's better to have more awareness, and especially on the need to protect both those who are positive and those who are not, to avoid further transmission.